Hi everyone, welcome back to my channel. In today's video, we will solve some case study questions. This is very important for your CPC exam practice. Let's start. Before that, don't forget to hit the like button, share this video and subscribe to my channel. This is the first case study. The preoperative diagnosis is left Achilles tendon rupture. Postoperative diagnosis is the same and the procedure is primary repair of the left Achilles tendon. Let us check the codes. Check the first code in option A 27650, which is for repair primary open or percutaneous ruptured Achilles tendon. And check the first code from option B 27652 is for repair primary open or percutaneous ruptured Achilles tendon with graft, includes obtaining graft. And 27600 is for decompression fasciotomy leg anterior or lateral compartments only, and the code 27654 is repair secondary Achilles tendon with or without graft. So which among these four codes is correct? In the procedure they have given primary repair of left Achilles tendon. So it is primary repair of left Achilles tendon. Therefore, the appropriate code will be 27650. 27652 is wrong because that is for with graft. In the question and also in the description of the procedure, they have not mentioned with graft. Eliminate option B. And the code 27600 is wrong because it is for decompression fasciotomy. That is also not mentioned in the procedure. And the code 27654 in option D, that is wrong because it is for secondary repair. Therefore, by looking at the first code from each option, we could eliminate the wrong answers first. The ICD code in option A S86.012A is for strain of the left Achilles tendon initial encounter. Therefore, the right answer is option A. Next question. Read the preoperative diagnosis, write cataract. The postoperative diagnosis is the same. Procedure is phacoemulsification with intraocular lens, IOL implantation. Let us check the code in option A. 66984 is for extracapsular cataract removal with insertion of intraocular lens prosthesis. One-stage procedure, manual or mechanical technique, without endoscopic cyclophotocoagulation. Check the code in option B 66982. 66982 is for extracapsular cataract removal with insertion of intraocular lens prosthesis, manual or mechanical technique, complex, requiring devices or techniques not generally used in routine cataract surgery. The first code in option C 66821 is for decision of secondary membranous cataract laser surgery, and the code in option D 66940 is for removal of lens material extracapsular. Which among these four codes is correct? The correct answer is 66984 because it is for extracapsular cataract removal with insertion of intraocular lens prosthesis, and they have mentioned phacoemulsification. Option B 66982 is wrong because that code is used for complex cataract surgery which involves additional surgical techniques or devices that are not mentioned in the procedure description. Option C 66821 is wrong because that is for decision of secondary membranous cataract laser surgery, that is not mentioned in the description. And the code in option D 66940 is also wrong because that is for removal of lens material extracapsular. It reflects cataract surgery without IOL. In the procedure, they have mentioned IOL implantation. Therefore, the right answer is option A. Take a moment to solve this question on your own. I'll reveal the answer at the end of this video.